Hello, this is my lab video, topical medication. So the first thing we always want to do, prepare our MAR to our doctor's orders. We want to ensure that it was transcribed properly. So if I look specifically, the Xenoderm ointment to right heel, Xenoderm ointment to right heel, correct name and date of birth, Roger Stevenson, February 2nd, 1950. Okay, everything else, the dates match, etc. So we can go ahead and we can start with our 5 rights and our 3 checks. So my first check I will do upon grabbing out of the medication drawer, which I have here. All right, so we have the right drug. Again, we're comparing our MIR to our medication. Right drug, Xenoderm ointment, right dosage, finger tube unit, 3 times a day. Okay, right patient, Roger Stevenson. Right route, topically to right heel, 8 a.m. Okay, we check our time, 8 a.m. Okay, great, good to go. So then I would do my second check. I'll also be checking the expiry date as I go. It's good to go, still within our time range. So second check we're gonna do while we're preparing the drug, which with the topical ointment is not much. We're just getting our just do our second check. Roger Stevenson, date of birth, February 2nd, 1950. Xenoderm ointment, fingertip unit, 3 times a day, Topically to right heel, right time, 8 a.m. It's 8 a.m. Okay, and then we could go ahead and do our third check as we prepare our tray here. So I have my tongue depressor, which we'll use to spread on the heel. According to standard procedure, we have a washcloth to clean the heel first. And we can do our third medication check. Roger Stevenson, date of birth, February 2nd, 1950. We got our right dosage, fingertip unit, 3 times a day, right route, topically to right heel, and right time, 8 a.m. Okay, go ahead. That's our 3 checks and our 5 rights. So we could go ahead, bring our tray here. We'll go into the patient's room. Good morning. How are you, Mr. Stevenson? My name is Monique. I will be your nurse today. I will provide privacy as best I can. We'll go ahead and also do my hand hygiene. Wash. I will apply clean gloves as well at this time. And then we'll go ahead and do our patient identifiers. I have my MAR right here. So Roger Stevenson, date of birth, February 2nd, 1950. Okay, so that's correct. He's oriented times 3. So then again, we will go over our allergies. It says here, none allergies. Mr. Stevenson, are there any allergies we should be aware of? No, go ahead. So upon, before we go ahead and apply the medication, we want to take time to do a good skin assessment on the right heel here. So of course I'll put my bed rails down, adjust the bed to the right working height, and obviously take off any socks or clothing he would have on his right heel. We go ahead and make sure there's no edema. We can do our C-temps, color, temperature, edema, moisture. I can't quite remember all of them now, but yeah, we would go ahead and do all of our assessment, make sure there's no skin lesions or anything to let the ointment into the skin itself. And just kind of check on our pressure ulcer that he had come in with, and we want to see if it's still in that stage 1, or if it's progressed, or if it's seeming to become better, etc. So then we could go ahead and we can talk to our patient. So we would want to go over the right reason we're using our ointment today. So Mr. Stevenson, the Xenoderm ointment is a medication to stimulate circulation in the skin. It can relieve pain and promote healing of your pressure injury on your right heel. So we want to make sure they're educated, right education. A temporary stinging may be felt. We're going to monitor for adverse reaction though. And then just make sure the patient knows they have the right to refuse. So Mr. Stevenson, are you comfortable with proceeding? Okay, great. So next, what we're going to do is we're going to administer the patient. So what we would do here is we would use our tongue depressor. Let's get that ready. we would take our cloth and we would just make sure everything was very clean, dry, especially dry. Clean, soap, dry, rinse, dry. Okay? Then we would take our tongue depressor and our medication. I would put 1 fingertip unit on the tongue depressor, and then we can go ahead, put it under the right heel. Just make sure we get it a nice thick layer on there. And then we need to make sure that the patient lets it dry fully before letting it, back onto the linens or like putting back socks on or anything like that. And yeah, we could elevate even the right leg if we wanted to allow the air to get underneath. So we can put like a bit of a pillow under to let his right heel be able to dry properly and whatnot. So at this time we would want to make sure if we had any linens soiled or it got any lotion on it or any dirt or wet moisture from washing, that we want to make sure we replace the linens and just make sure everything's very dry and clean. When we're done that, we just gather all our garbage, everything we have here. We put our rails back up. We would make sure the height of the bed is comfortable, the patient is comfortable, they're in the position they want to be in, they know where the call bell is. And, in that 5 minutes, we'll make sure that the skin is not reacting to the ointment. And then, yeah, we'll just make sure we come back around every, 5-10 minutes to make sure he's still comfortable. Put that leg back down, put some warm socks on if they want, or whatever makes them happy. So at that time, I would come back, I would dispose of all my garbage, my gloves. I would perform hand hygiene again, wash, wash, wash. And then I would go to my right documentation. So on my MIR here, I have my Xenoderm, 8 a.m. I would go ahead, make sure it's the right date, right time, document, it's been done. Okay, right evaluation. So the medication was administered properly. Yes, I would say so. No signs of adverse reaction at this point. Everything looks pretty good. It's feeling good. And we just want to make sure we come back around to check on our patient.